Hey class, welcome to drug quiz number 2, week 3. So let's get rolling. Hope everything's going well as usual. Send questions if you have any. So first drug is another antibiotic, azithromycin, used a lot. So most commonly for respiratory infections, but we see it for dental stuff, skin infections, all sorts of things. So brand name is Zithromax. You may have heard of a Z-Pack or a Tri-Z-Pack. Commonly dispensed generic at this point. It's a macrolide antibiotic or antibacterial. All right, next one, clarithromycin is Biaxin, and this is also a macrolide antibacterial, not used as commonly, but we still see it pretty regularly. Tetracycline, known as Sumicin, Alatet, which honestly I've never heard in my career, broad-spec, also never heard. It is a tetracycline antibiotic or antibacterial. It's related to doxycycline, which I believe we reviewed last week. Interesting thing about tetracycline, it cannot be given to children with developing teeth. It can actually cause permanent discoloration. So it's typically used for prevention or treatment of acne, but we don't see it too often. Nitrofurantoin is kind of in a class of its own. It's macrobid or macrodantin, two different salt forms of the drug. Antibacterial, pretty much only used for urinary tract infections, and we see it all the time. Mupirocin, brand name is Bactroban. It is a topical antibiotic, used quite a lot for skin infections, various prevention and or treatment of skin infections. So we see this a lot. Next one is clindamycin or Cleocin, another antibiotic. One of the things we see it most commonly used for is for people who have a penicillin allergy, in particular for dental procedures or prophylaxis. Some people have to take antibiotics before dental cleanings to prevent infections in heart if they have like heart valve replacements and sometimes other joint replacements, although those guidelines tend to change year by year. Another very common antibiotic, metronidazole or Flagyl. Again, antibacterial or antibiotic. It also has some effect on protozoa, so anti-protozoal as well. And then we have penicillin, known as Pen-VK or Pen-V, oral liquid suspension. You see it in the hospital. It is a beta-lactam antibiotic. Also, it's kind of a class of its own, the penicillins, but you may recall that it's related to amoxicillin. Then we have valacyclovir, brand name is Valtrex, very commonly used antiviral, most commonly for herpes simplex infections. Not fun, extremely common out there. And then last for this week is oseltamivir or oseltamivir. It depends on who you are. Tamiflu, and this is an antiviral, but you can tell by the name, it is used for flu. Used to be prescribed a lot. We have not seen it much recently, probably because we have so little flu because everybody's wearing masks. So, yeah, interesting drug. I personally don't think it's very effective. It's most commonly prescribed in high-risk people who are most likely to get complications from flu, like pneumonia, and end up in the hospital. But it comes with a whole host of flu-like side effects, including upset stomach, diarrhea, vomiting, that sort of thing. So for very low efficacy, I don't know that it's worth it for the average patient. So anyhow, that's it for this week. If you want to know any more tidbits or have any questions, like I said, send a question on GroupMe or send me an email, and good luck on your quiz this week. Bye-bye.